Imagine that, without knowing it, you may be facing an invisible enemy that drains your energy, steals your motivation, and deepens feelings of sadness or apathy. And the most surprising part, all of this may be related to a lack of 3 specific nutrients in your body. If you are over 60 years old, it's even more important to pay attention to this silent signal your body is giving before it turns into something more serious. In this video, you will discover how small deficiencies in vitamin B6, magnesium, and folate can directly affect your mood, sleep, and even your memory. And the best part, you'll learn how to identify these signs in your daily life and what you can do, in a simple and safe way, to regain emotional balance and well-being. Stay until the end to learn a practical tip that can transform your mental health in a surprising way. This information is not just curious, it's valuable, especially because many elderly people face symptoms of depression without knowing that the trigger may be on their plate, and not just in their thoughts. When you understand how your body works, everything changes. Your health gains new meaning, and you regain autonomy over your quality of life. If this topic interests you, take a moment to like the video, subscribe to the channel, and share it with someone who needs this information. And tell me in the comments, have you ever suspected that your diet could be influencing your mood? The answer may surprise you and help others going through the same doubt. Now, let's begin this journey into what really happens between nutrition and emotions. For a long time, it was believed that depression was just an emotional or psychological issue. But in reality, science has shown that what we eat has a profound influence on how we feel. The brain, like any other organ in the body, depends on specific nutrients to function properly. When it lacks fuel, it begins to fail, and the first signs may appear in our emotional state. The interesting thing is that the brain uses various nutrients to produce so-called neurotransmitters, substances responsible for regulating mood, sleep, energy, and even the ability to concentrate. Serotonin, dopamine, GABA, all these chemical messengers need the right ingredients to be produced. And this is where vitamin B6, magnesium, and folate come in. Without them, the brain's chemical factory simply does not work well. Additionally, nutritional deficiencies increase inflammation in the body, and this also directly affects the brain. Silent inflammation can decrease the activity of regions responsible for motivation and pleasure, while increasing stress. The result? A person feels discouraged, irritable, or sad, even when everything seems normal on the outside. In old age, this link between nutrition and emotions becomes even more delicate. The body no longer absorbs nutrients in the same way, and internal stores gradually diminish. It's like trying to keep a light bulb on with a weak battery. The light flickers until it goes out completely. That's why understanding this cycle is so essential to maintaining quality of life after 60. And if all this sounds complex, don't worry, the next steps will show you, one by one, how these nutrients work and why their absence can completely change the way you see the world around you. Vitamin B6 is one of the least talked about protagonists when it comes to mental health, but its role is decisive. It is involved in the production of serotonin, dopamine, and GABA, 3 neurotransmitters directly linked to good mood, anxiety control, and sleep quality. Without enough vitamin B6, these messengers simply are not produced as they should be, and the result appears in the form of irritability, apathy, and persistent sadness. In old age, B6 deficiency is more common than you might think. This happens because, over the years, the body loses part of its efficiency in absorbing this vitamin from food. In addition, the frequent use of certain medications, such as those for high blood pressure or blood sugar control, can further interfere with this absorption. That is, even with a reasonable diet, the risk of deficiency remains high. The warning sign can begin with subtle symptoms: unexplained fatigue, a feeling of mental confusion, trouble sleeping, or even muscle aches. In many cases, these symptoms are attributed to normal aging, but the real cause may be linked to a lack of B6. Ignoring these signs can lead to worsening of the condition, resulting in depression that is more resistant to conventional treatments. In addition to mood, vitamin B6 also helps maintain immune system health and protects the brain against premature aging. A nourished brain functions with more clarity, sharp memory, and emotional stability. That's why, when investigating causes of depression in the elderly, the most attentive doctors always evaluate the levels of this vitamin. And there's another little-known factor. Even small amounts of B6 supplementation, when done under medical guidance, can bring surprising results in just a few weeks. But before thinking about supplements, it's worth learning about another nutrient that works alongside it, and whose absence also has profound effects on the mind. Magnesium is one of the most important minerals for nervous system balance, but also one of the most overlooked. It acts as a true brake on states of brain agitation, helping control stress, anxiety, and even episodes of insomnia. Without enough magnesium, the brain stays in a constant state of alert, as if the rest button were broken. In old age, this problem intensifies. With aging, the kidneys begin to excrete more magnesium, and the intestine reduces its absorption. The result is an invisible cycle: less magnesium in the body, more mental and physical tension. The elderly may feel palpitations, difficulty relaxing, sensations of anguish without reason, and even chronic muscle pain. All of this can be mistaken for symptoms of other diseases, when in fact the body is crying out for help. The most concerning part is that low magnesium levels also directly affect the production of serotonin and dopamine, two neurotransmitters essential to emotional well-being. Without these compounds, feelings of hopelessness and sadness become more frequent. The person starts to feel emotionally exhausted, even when resting. Moreover, magnesium contributes to the regulation of cortisol, the well-known stress hormone. When there's an imbalance in this hormone, the body enters a state of constant alert, which can trigger or worsen depressive conditions. With a simple correction of magnesium levels, many of these reactions can be softened or even eliminated. But magnesium doesn't act alone in this scenario. There's another nutrient, just as crucial, that is often forgotten, and whose absence can also deeply affect mood, energy, and memory. Folate, also known as vitamin B9, is essential for brain health, but is rarely mentioned when talking about depression. It is directly involved in the production of neurotransmitters like serotonin and norepinephrine, which are fundamental for maintaining emotional balance. Without sufficient folate, these substances drop drastically, making way for persistent feelings of sadness, discouragement, and loss of pleasure in activities. In old age, folate deficiency is even more common. This is due to natural changes in the digestive system, lower consumption of B9, rich foods, and often the continuous use of certain medications. The problem is that lack of folate can worsen the response to antidepressant treatment or even make it ineffective. That is, even with medication, depression may persist if there is no nutritional correction. Folate also has another vital function. It protects the brain against the buildup of homocysteine, a toxic substance associated with cognitive decline, memory loss, and even Alzheimer's. Maintaining good B9 levels means, in practice, preserving mental clarity, reasoning ability, and intellectual independence during aging. An impressive fact: studies show that folate supplementation in elderly people with diagnosed deficiency can significantly improve mood and cognition in just a few weeks. It's not about a magic solution, but rather replacing what the body needs to function in balance. And the impact can be greater than many people imagine. Now that you know the three invisible protagonists of mental health, it's time to understand why these deficiencies become so frequent precisely after age 60, and how it happens without most people noticing. From age 60 onward, the human body undergoes a series of transformations that directly affect how nutrients are absorbed and used. One of the main factors is the reduction in stomach acidity, something common with aging. With less acid in the stomach, the absorption of vitamins and minerals, such as B6, magnesium, and folate, becomes less efficient, even with a balanced diet. Another important point is the continuous use of medications, something frequent in old age. Medications for blood pressure, diabetes, reflux, and cholesterol can interfere with nutrient absorption or accelerate their elimination by the body. In the long run, this creates an invisible leak of essential vitamins and minerals without the person noticing. The result? Fatigue, mood swings, and difficulty concentrating become constant. In addition, many elderly people face a natural reduction in appetite. Eating less, it's common for both variety and nutritional density of meals to decrease. The body stops receiving the basic elements needed to keep the brain fully functional. Eating becomes a mechanical routine, not a real source of nutrition. Gradually, imbalance sets in, affecting mood and energy. There's also the social factor. Loneliness, loss of loved ones, and changes in routine also affect emotional state and, indirectly, nutrition. In many cases, the elderly no longer find joy in eating, or end up opting for quick meals, poor in nutrients. Thus, the deficiency adds to emotional fragility, creating a cycle that only worsens if not interrupted in time. Recognizing these causes is the first step toward finding real solutions. And when the signs start to appear in daily life, even if subtle, it's essential to know how to interpret them. The body gives clear warnings, but many people still ignore them. Many people believe that the symptoms of vitamin and mineral deficiency are always physical, like pain or weakness. But in reality, the first signs are often emotional and mental. Persistent sadness without an apparent reason, lack of energy for simple tasks, loss of interest in previously enjoyable activities, these are silent alerts that something isn't right inside. Other signs include constant irritability, frequent forgetfulness, and even changes in sleep. It's common for an elderly person to wake up several times during the night or have trouble falling asleep, without realizing that this might be related to a lack of magnesium or B6. In some cases, there are even physical symptoms associated: palpitations, tingling sensations, or muscle pains that don't go away with rest. Many of these complaints are normalized with phrases like, "It's just old age," or "the body is wearing out," when in fact they are the body's responses to nutritional imbalances. Ignoring these signs can cause the emotional condition to worsen, leading to clinical depression or progressive loss of autonomy. It's important to observe subtle changes in behavior. An elderly person who begins to isolate, eat less, or always seem tired may be suffering from something far beyond what the eyes can see. Family members and caregivers also need to be alert, as these clues are not always verbalized, but they clearly manifest in day-to-day attitudes. Recognizing these signs is the first step. The next? Knowing what to do. Fortunately, there are simple and accessible ways to correct these deficiencies and restore well-being in a surprising way. The good news is that, in most cases, correcting deficiencies in vitamin B6, magnesium, and folate doesn't require radical changes. The first step is to talk to a healthcare professional to assess the levels of these substances in the body. A simple blood test can reveal much more than you imagine and indicate whether supplementation or dietary adjustments are needed. In everyday life, small choices make a big difference. Including foods rich in these nutrients is a safe and natural way to strengthen both body and mind. Legumes, dark leafy greens, eggs, seeds, nuts, and whole grains are powerful allies. But attention, in old age, food alone may not be enough due to absorption limitations. That's why medical guidance is essential. If necessary, supplements can be prescribed, always in the correct dosage and with monitoring. The most common mistake is self-medicating, thinking that more is better. In the case of vitamins and minerals, excess can also cause problems. That's why each body deserves an individualized plan, respecting its needs and limitations. Furthermore, taking care of emotional health as a whole is essential. Enjoyable activities, social connections, and moments of leisure also help regulate the well-being hormones. When mind and body work together, the result is more energy, lightness, and quality of life, even in the face of aging's challenges. And perhaps the most important thing is to remember that it's never too late to take care of yourself. Regaining vitality may be just a few adjustments away. But for that, information, attention to signs, and conscious action are needed. Everything starts with a simple step, and now you already know what it is. Throughout this video, you've discovered how 3 seemingly simple nutrients, vitamin B6, magnesium, and folate, can have a profound impact on your mood, energy, and mental clarity. Especially after the age of 60, when the body starts to function differently, knowing these details makes all the difference in preserving well-being and autonomy. This is information that, when applied, can transform not only your days but also your way of aging. More than fighting sadness or discouragement, understanding the role of these nutrients is a step toward a life with more clarity, joy, and purpose. Many times, what seems like a case of depression or fatigue may have a much simpler and treatable cause than you think. And you don't have to face it alone. The right information at the right time can open doors to real solutions. Remember, taking care of the mind is also taking care of the body. And the reverse is also true. From today on, pay more attention to the signs your body sends. Fatigue, insomnia, forgetfulness, irritability, All of these can be silent cries for help that deserve to be heard. And now, with everything you've learned, you're more prepared to act consciously and preventively. If this content helped you in any way, don't forget to like, share it with someone who needs to hear this, and subscribe to the channel to receive more videos like this. And tell me in the comments, which of these signs have you already noticed in your daily life? And which of these nutrients do you suspect might be lacking in your body? Your experience may help others identify themselves and seek help at the right time.